talk about the thyroid gland, which is very important in controlling the metabolic rate. And Margaret Jasinska is going to enlighten us all about the power of this remarkable gland and just how common problems can be and often missed. So, hi Margaret.
Hi Dr. Cabot.
Great to be with you again.
Thank you.
So, we all heard of the thyroid gland and we know that it's something to do with metabolism, but what exactly is it making and how does that speed up our metabolism?
So your thyroid gland is a butterfly-shaped gland in your neck, and it makes two main hormones, T4 and T3, and those hormones control your metabolic rate mainly. So basically the rate at which the cells of your body burn up calories and use them for energy. But your thyroid gland also controls growth when you're younger. It helps to regulate your body temperature. In fact, every cell in your body contains a receptor for thyroid hormone.
Yes.
So it has really far-ranging effects, and that helps to explain why when something goes wrong with your thyroid, so many symptoms can present.
Yes, that's right. And it's interesting when you say it makes different hormones, it makes T4 and T3. And I've always been fascinated by what a simple hormone, thyroid hormone, is, because you've just got the amino acid tyrosine and some molecules of iodine. It's a very, very simple hormone, yet incredibly powerful. So what's the difference between the T4 and the T3?
Well, your thyroid gland makes a lot of T4 thyroid hormone, but that's actually not the active hormone. So T4 needs to be converted into its active form, which is T3.
Yeah.
And a little bit of that conversion happens in the thyroid gland, but most of it actually happens in your liver. So we get back to the liver again, and you've got to have a healthy liver if you want to have efficient thyroid hormone function.
Yes, that's right. So if you have a fatty liver, there's not enough healthy liver cells there to convert the T4 into the T3. That is also going to give you a sluggish metabolism. So what happens is the T4 has got the 4 molecules of iodine, and it has to lose one of those molecules to turn into T3. And when it has only 3 molecules of iodine, it's a lot more active. And I've had patients, Margaret, who have asked me if they could have prescription T3 just to lose weight. And, you have to be careful with it. I mean, it does work, but you have to be careful because if you take too much of it, then that's bad for your bones and you can lose calcium from your bones.
Exactly, and it's also not good for your heart and your blood pressure, and it can just make you feel anxious and not be able to sleep well. So you want your thyroid gland working well, and you want the hormones to be just right, not too high, not too low.
Yes, and sometimes, you really need to fine tune it and tweak it, and that'll make all the difference to your metabolism. Now, underactive thyroid is very common, so tell us, what are the most common symptoms or signs that your thyroid is underactive?
Well, weight loss is the most common one, and inability to lose weight. So where your old tricks just aren't working anymore. You can be eating well and exercising, but the weight's just not coming off.
Yes.
And people with an underactive thyroid generally get fluid retention as well. They can get dry skin and dry hair. They can even lose some scalp hair. They can find that their thinking becomes foggy. It's difficult to concentrate. They may get depressed, and it can be a really subtle depression where they're just not aware of what's causing it.
Yes, that's right. It can be subtle, and you can lose muscle mass. Your muscles can get weaker and smaller, and you can get conversion of muscle into fat, and you can get this special type of fat called myxedema in the legs. So, we don't want to lose our lean muscles. So thyroid is very, very important for muscle tissue, and cholesterol can also go up if your thyroid's sluggish.
Yeah, that's quite common, particularly in postmenopausal women. When their cholesterol starts to go up, often it's because their thyroid has become sluggish.
Yes, and it really can be quite subtle. So it's something, as a weight loss detective, we think a lot about. So, we can measure these wonderful thyroid hormones, the T3 and the T4, and yet sometimes quite a significant thyroid problem will be missed with just conventional blood tests for thyroid function or with the wrong interpretation of the test. You've got to interpret the test correctly. So the most commonly performed test is TSH, which stands for thyroid stimulating hormone, and that's a screening test. So how aware do we need to be of that? You know, because a lot of people get told, well, you know, you're just in the normal range, but is that good enough?
No. And so the hormone TSH is actually made by your brain, not by your thyroid gland, but it's a good indicator of how well your thyroid gland is functioning, which is why it's the most commonly tested hormone. And most GPs will only test that one hormone, whereas, as we mentioned, your thyroid gland makes two hormones that aren't tested in most blood tests. And also your TSH might be in the so-called normal range according to the pathology company, but it's certainly not in the ideal range.
Yes, that's right. So, you know, in Australia, the normal range is commonly depicted as 0.5, so 0.5 to 4.5, and anything within that is said to be normal. So often the patient is told, well, you know, you're still in the normal range, we'll come back and we'll recheck you in a year. And meanwhile, the patient continues to put on weight for no reason and gets tired, the muscles get weak, more fat tissue builds up. And eventually, of course, the TSH goes way out of the normal range, and the doctor says, well, I think we're better treating you. And the patient says, finally, but, you know, they've put on so much weight, it's harder for them to lose it now. So early treatment is important. And what about if they've got a family history, Margaret? I know, you know, that's very important to do the family history in people with weight problems, but what types of tests should we be doing then if there is a family history of thyroid disease?
Yes, so thyroid problems often do run in families, and the majority of thyroid problems are actually caused by an immune system problem, an autoimmune disease, and those conditions tend to run in families. Yes. So it's a good idea to have another type of blood test. If you've got a family history of thyroid problems, have a blood test called Thyroid Antibodies, because they are the first indicator that something bad is brewing, and that if you do nothing, eventually you'll probably get a full-blown thyroid problem.
Yes. So, you know, often we'll pick up those thyroid antibodies years before you have a thyroid problem.
Exactly.
So it's predictive. And, you know, your thyroid antibodies, which are like these little missile proteins in your blood, they shouldn't be above 100, generally speaking.
Yes.
And it's not uncommon to see people with 500, you know, 1,500, 3,000. And people haven't got a clue that they're there.
That's right. Yeah. And they're just antibodies that your immune cells are making, which are actually slowly destroying and attacking your thyroid gland. Yes. Your immune cells are behaving as though your thyroid gland is a harmful virus or bacteria that should be destroyed, whereas in fact, of course, it shouldn't. But it's a great test to have. You'd have to ask for that test, though. Your GP is very unlikely to order it.
That's right. So if you've got a family history of underactive thyroid or any type of thyroid problem, ask for a thyroid antibody test as well as your TSH test. And if you've got really high levels of the thyroid antibodies, it's very important to get them down, otherwise you will develop thyroid disease. Now, a lot of doctors, Margaret, will say, oh, you can't do anything about that. You can't get your thyroid antibodies down. So what do you say to that?
Well, there are no prescription drugs to do that, so the average GP has nothing to offer you, but it's really fixing your immune system that is important. And calming down an overactive immune system is just a symptom of a hyperstimulated immune system. Yes. So the main treatment for thyroid problems is actually treat the immune system, or treat the reason why you've got the thyroid problem in the first place.
Yes, that's right. So we'll be looking at the treatment for thyroid, but of course, you know, if you have an autoimmune problem, you have got to go back to the gut and the liver. You know, as Hippocrates said, good health begins in the gut. And it's still true today, you know.
Exactly.
He was right. Now, one other interesting thing, you know, we've mentioned TSH test and free T4 and T3 and thyroid antibodies. We can also measure something called reverse T3, and that's getting really fancy, isn't it?
Yes. Yeah. So your GP may not even know about that, But as we said, the T4 gets converted into its active form T3, and a little bit will also get turned into a molecule called reverse T3, which is an inactive form of that hormone. But some people's bodies make too much reverse T3, so therefore they don't have enough active thyroid hormone in their bloodstream. A number of things can cause that. A big one is selenium deficiency and also stress. Some prescription medication can cause high reverse T3. Insulin resistance can cause high reverse T3. So for people who may have a normal TSH level but still don't feel well, good idea to have reverse T3 checked. Or people who are on thyroid medication but still don't feel well, get your reverse T3 checked.
That's right. There's a lot of people on thyroid medication who they're overweight, they're tired, and they think, why? Now I'm taking my T4 tablets, my thyroxine or Synthroid, whatever brand name they're using, and I don't feel any better. Why can't I lose weight? Why am I tired? And why is my cholesterol still high? And they get very frustrated. So that's what Margaret's saying. If your treatment's not working, look deeper. Remember, the weight loss detectives never give up. We keep looking deeper and deeper and deeper because we are going to find the cause. We're going to get the weight off you. So have a thyroid antibody test. If they're high, get the antibodies down by improving the gut and liver function. Selenium is imperative to get the antibodies down. And have a reverse T3 test. If it's very high, once again, you've got to improve the liver, don't you?
Exactly.
Yeah.
Yep.
And the other thing that's often worth testing is your body temperature, your basal body temperature, which is really resting metabolism. In that state, it will reflect your temperature. So you wake up in the morning, now before you move much, before you get out of bed, ideally use a mercury thermometer. So have it by the bedside, put it under the tongue and leave it there and for about 5 minutes ideally, and then just totally relax, and your body temperature in that state should ideally be above 36.5 degrees Celsius. Now, if it is between 36 and 36.5, it just could be depending on the phase of your menstrual cycle, but it could be a sign that your thyroid is becoming sluggish. If it is below 36, then it's highly likely that your thyroid is sluggish and you may be lacking selenium. You may be making too much reverse T3 and not the proper T3. And the other thing that it could reflect, which is really interesting in women, is your progesterone is low. Particularly after ovulation, your body temperature should go up about 0.5 degree. And in some women it goes up more. So progesterone is thermogenic, so that elevation of body temperature is going to speed up your metabolism. So, if your body temperature is static, it's generally too low, that could be a sign of a sluggish thyroid. And if it lasts the whole month, a sluggish ovarian function, which could also be impacting on your weight.
Exactly.
Yeah.
So that's an easy, simple test that you can do yourself at home to give you a good indicator of how your thyroid is going?
Yes, I think so. And, people will say, well, after they've balanced their thyroid by, improving their diet, perhaps taking some nutritional supplements, and in women, they may also need natural progesterone cream or troches to help their thyroid. They find their body temperature goes up, and that is concurrent with an increase in the rate at which they're burning fat and losing body weight.
Yes, good sign.
Yeah, so it all works. It all goes in harmony together. So let's talk a bit about fine-tuning the thyroid gland, because we often find, Margaret, that people have a slightly sluggish thyroid. For example, their TSH might be 4, and ideally it should be really less than 2.5, shouldn't it?
That's right, because some research has shown that if your TSH is above 2.5, you've probably already got some background thyroid disease beginning, and we often refer to that as subclinical thyroid disease.
Yes, and it could manifest as weight gain, being overweight, tired, puffiness of your legs. So we want to improve the function. We want to optimize the thyroid gland. Like a car, you know, it needs fine tuning so you have top performance in your cells, will help you burn fat. So what tests, you know, we mentioned TSH, free T3, T4, body temperature, thyroid antibodies, reverse T3. What about looking at some nutrients? How can we test for the nutrients that the thyroid needs?
Well, your thyroid gland requires iodine because thyroid hormone is literally built of iodine, and so many people are iodine deficient. We regularly test our patients at our clinics, and it's rare to find someone who's not iodine deficient. And there's a urine test that you can get which actually measures how much iodine is in your body.
Another useful test is to measure the amount of iodine in your body. If you have a sluggish thyroid, it could be due to a lack of iodine. So tell us about that test.
Yes, and in fact that's really common, and you need iodine in order to make thyroid hormones. It's literally built of iodine. And so many people are iodine deficient. There's a urine test that you can easily get done which measures how much iodine is in your body. And it's a useful guide to tell you how much of an iodine supplement you may need, because you don't want too much iodine and you don't want to be deficient either. So for optimal thyroid function, ideally your urinary iodine level would be between 100 and 300.
Yes, and a lot of people need to take a supplement that contains iodine, unless you're eating seaweed regularly like the Japanese do, or having a lot of iodized salt, and even then you probably won't get enough just from salt.
Yeah, it's really hard to get enough just through diet, and a lot of seafood is farmed these days, so it's not a very good source of iodine anymore.
Yes, I see a lot of iodine deficient people. Sometimes their iodine is very low, you know, 20 or 30, and no wonder their thyroid function is sluggish.
Exactly, it'll give you a slow metabolism, make you tired, make weight loss so much harder than it has to be.
Yes, you know, mineral deficiencies can contribute to weight excess through a sluggish metabolism. So we know if you're low in iodine, you can have a sluggish metabolic rate. Also, if you're low in sulfur, that's a mineral that helps your liver to function. If you're low in chromium, you're going to be more likely to be insulin resistant. If you're low in magnesium, that's a mineral that's important for insulin and blood sugar control. So a lot of people get too much food, they overeat, but they're still deficient in certain vitamins and minerals that are strategic to metabolism. It's an interesting concept, isn't it? Because, you know, when you see someone overweight, you think, oh, they don't have deficiencies, they just need to eat less. No, often they just need to take some minerals to get their metabolism going, and then they'll lose weight a lot more easily. Now, another deficiency that I think contributes a lot to sluggish thyroid and liver function is that of selenium. So Margaret, tell us a bit about that.
Yes, so selenium is a mineral that's really quite deficient in the soil in Australia and New Zealand in general, and you need selenium in order to make active thyroid hormone, to convert the thyroid hormone from T4 into T3, and also selenium deficiency increases your risk of developing an autoimmune thyroid disease. So basically, if you're selenium deficient, you're more likely to get a thyroid problem, and then you'll be worse off and your thyroid problem won't be treated well enough.
Yes.
And it's really difficult to test selenium. Blood tests aren't accurate. We don't recommend that. There's not a lot of selenium in your blood at any one time. Most of it's in your organs and tissues. In research settings, they measure people's toenail selenium, but the average pathology company isn't going to do that for you. So because it's a mineral that's so difficult to get enough of in your diet, if you do have a thyroid problem, we strongly recommend that you take a selenium supplement, an average of about 200 micrograms a day, and just see how you feel. Because more than likely you'll notice a dramatic improvement in how you feel.
Yes, and the other thing that can help thyroid is vitamin D. And we know the most common cause of sluggish thyroid function is autoimmune disease. So we need to reduce the inflammation that is produced by our autoimmune disease, and vitamin D can help to do that. And just like iodine and selenium deficiency, vitamin D deficiency is epidemic. And it really should be above 100. So Margaret, tell us a little bit about vitamin D and how much we should take, and how often we should have our levels measured. It is such an important vitamin that I don't think people really think about it nearly enough.
Exactly, yes. Vitamin D is getting a bit more publicity lately, but still nowhere near enough.
Yes.
So we make vitamin D from sunshine, but only from UVB rays, and they're only out there in the middle of the day. So you've got to go out into the midday sun, never long enough to get burnt. And it depends on your skin tone as to how long you need to be in the sun to make enough vitamin D. For a fair person, it's usually about 15 minutes at midday sun, 7 days a week. And most people just don't have the time to do that. They're working, they're busy, they're indoors. And depending on where you live, the sun isn't necessarily strong enough all year round. If you lived at the equator, well, you could make vitamin D from sunshine all year round.
Yes.
But the further away you are from the equator, the weaker the sun is during autumn, winter, early spring, so you can't rely on sunshine anymore. And so for a lot of people, a vitamin D supplement is just essential. They're not going to get their vitamin D level into the optimal range without it.
Yes, I agree. It's an epidemic, vitamin D deficiency, and don't forget it'll give you osteoporosis. You can take all the calcium in the world, it's useless if you're low in vitamin D. And also vitamin D reduces your risk of cancer.
17 different types of cancer vitamin D deficiency is a risk factor for.
Yes.
So it's pretty scary and it's dangerous to be vitamin D deficient, so find out if you are.
Yeah, so we're saying if you're iodine deficient, if you're selenium deficient, if you're vitamin D deficient, not only are you more likely to be overweight, you are far more likely to get cancer. And people don't hear this message. It's a very important message. All the sunscreen in the world isn't going to protect you against skin cancer if you're low in vitamin D, selenium and or iodine. Yeah. And iodine reduces the risk of breast cancer. And a lot of overweight women get breast cancer.
That's right, yes. And iodine deficiency, a symptom of that can be lumpy breasts, and women with lumpy breasts are more likely to develop breast cancer eventually. So an iodine supplement does wonders for lumpy breasts.
Yes, and you can get supplements that combine your vitamin D, your iodine, your selenium, all together in the right doses to promote thyroid health and breast health.
Exactly, it makes it so easy, convenient, economical.
Yes, so there you go. You can be overweight and very malnourished at the same time.